Congratulations on considering bariatric weight loss surgery. You've taken the first step towards a healthier and fuller life. This video will explain everything you need to know.
Hello, I'm Dr. Molly Busden, one of the general surgeons here at Atlantic Surgical Associates since 2007. Prior to joining the team here, I was the Assistant Chief of Surgery at Union Memorial Hospital in Baltimore, Maryland. I completed a combined Bachelor of Science and Medical degree from the University of Michigan. I then began my training in general surgery as well as a minimally invasive surgery fellowship at the University of Maryland. I currently serve as the Chief of Surgery at Portsmouth Regional Hospital. I've found that performing bariatric surgery gives my patients a chance to get a new lease on life, and it is indeed one of the most rewarding surgeries to perform in terms of patient satisfaction and well-being.
Hi, I'm Dr. Dmytro Haveleshko, fellow bariatric surgeon at Atlantic Surgical Associates. I'm an associate fellow at the American College of Surgeons and the Society of American Gastrointestinal and Endoscopic Surgeons. I completed my surgical training in Ukraine, and then I moved to the United States and completed additional training at the University of Virginia in Charlottesville and at the University of Alabama at Birmingham. The reason I love doing bariatric weight loss surgeries is a feeling of instant reward when you see your patients after the surgery and they tell you, Dr. Haveleshko, you brought me back to life again. At that moment you realize you just became a part of their life story forever and changed a little bit of their future. The only thing patients regret, they did not start our weight loss program sooner.
Hi, I'm Dr. Cynthia Pachuli, board-certified general surgeon here at Atlantic Surgical Associates. I completed my Bachelor of Arts in Psychology at Baylor University in Waco, Texas, and earned my medical doctorate from University of Texas Southwestern Medical School in Dallas. I then began my residency training in general surgery, as well as 2 years of physiologic research at University of Maryland before completing a year of fellowship training at Carolina's Laparoscopic and Advanced Surgical Program. I arrived here on the Seacoast in 2002, helped found the bariatric program in 2003, and have been involved with hospital leadership in various capacities. I'm currently the Chief of Medical Staff for Portsmouth Regional Hospital. When my partners and I looked into performing bariatric surgery 13 years ago, I found I was guilty of some of the same societal biases that say obese people need to just exercise more, eat less, and make better choices. The more we learned, though, the more we understood that once an individual has severe obesity, more than 95% of them will fail at weight loss within a year of using these techniques alone. Bariatric surgery, along with these methods, is extremely successful long-term for more than 85% of patients. It's incredibly rewarding to have even a small part in helping these patients obtain a second chance to have a healthy, high-quality life.
We're here to help you through this process, educate you, and help you make an informed decision. Watch this seminar in a quiet area. Have a pen and paper ready to jot down any questions or notes. After you've watched the seminar, you'll receive a call from one of our staff members to discuss your first consultation, and you may ask them any questions you have at that time.
We will be discussing the background on the obesity epidemic and the rationale for weight loss surgery. We will outline the different types of weight loss procedures offered at Portsmouth Regional Hospital, and of course, the overall health benefits of undergoing weight loss surgery. Over the last 20 years, the percentage of Americans who are obese has dramatically increased. It is the most chronic health problem and the second leading cause of preventable death. More than 50% of adults are overweight. About a third of both adults and children are obese, and greater than 5% are considered morbidly obese. Obesity is actually a disease in and of itself, and it causes dysfunction in multiple body organ systems. The good news is that for individuals failing conservative treatment of obesity, surgical treatment is available. It is extremely effective and sometimes the only available cure of certain obesity-related medical conditions.
So what are the risks of being obese? Obesity can lead to many dangerous health conditions, including diabetes, asthma, hypertension, arthritis, joint pain, stress incontinence, migraines, depression, and fertility problems. It is anticipated that the next generation will not live as long as the current generation if things continue the way they are. If your weight is more than twice your ideal body weight, your risk of early death is doubled compared to someone who is not obese. When combined with a comprehensive treatment plan, bariatric surgery can act as an effective tool to provide you with long-term weight loss and help you increase your quality of health. Bariatric surgery has been shown to improve or resolve obesity-related conditions such as type 2 diabetes, high blood pressure, heart disease, and more. Significant weight loss through bariatric surgery may also pave the way for many other exciting opportunities for you, your family, and most importantly, your health.
This is the first 3 digits of your 9-digit patient code number that you'll need to have available for pre-qualification for your first consult after viewing this seminar. The next 6 digits will be displayed throughout this seminar.
Now, let's discuss how we define obesity. The BMI, or body mass index, is a ratio of weight over height, and it's a more accurate predictor of class of obesity than just weight alone. The normal body mass index ranges between 15 and 25. An individual is considered overweight if their BMI is up to 29. Class 1 obesity is defined if the BMI is between 30 and 35. Class 2 is between 35 and 40, and Class 3, or severe obesity, is when BMI exceeds 40. You can easily calculate your body mass index with a chart like this. Just find the number where your height and weight intersect. You might be a candidate for weight loss surgery if your current BMI is greater than 40 without any medical conditions, or BMI of 35 with at least one major comorbidity like hypertension, diabetes mellitus, sleep apnea, or other medical problems. Weight loss surgery helped you to lose weight in 2 possible ways: restriction and malabsorption. Restrictive surgery restricts the amount of food that you can comfortably eat so you can take in fewer calories. Malabsorption not only restricts your body's calorie intake, but also limits your body's ability to absorb nutrients and calories.
Bariatric surgery, such as gastric bypass and gastric sleeve, work by changing the anatomy of your gastrointestinal tract, or by causing different physiologic changes in your body that affect your energy balance and your fat metabolism. Regardless of which bariatric surgery procedure you and your surgeon decide is best for you, it is important to remember that bariatric surgery is a tool. Weight loss success also depends on many other important factors, such as nutrition, exercise, behavior modification, and more. By changing your gastrointestinal anatomy, certain bariatric procedures will affect the production of intestinal hormones in a way that reduces hunger and appetite and increases feelings of fullness. The end result is reduction in the desire to eat and in the frequency of eating. Interestingly, these surgically induced changes in hormones are opposite those produced by dietary weight loss.
This is the second set of your 9-digit patient code number that you'll need to have available for pre-qualification for your first consult after viewing this seminar. The next 3 digits will be displayed at the end of this seminar. Let's take a moment to pause and hear about one of our own patient testimonials and her journey to a healthier lifestyle.
My name is Jessica Davis. I'm 31 years old and I've had gastric bypass surgery. Prior to having gastric bypass surgery, life was very lonely. I wasn't able to do a lot of the normal activities that normally people can do. Sit in booths at restaurants were difficult. I couldn't go on an airplane. It made it very difficult to visit family and friends. I couldn't work out, and I really wasn't able to have a real life. I looked at the direction I wanted my life to go into. I was almost 30 years old. I wanted to get married and have kids, and really felt that it wouldn't be fair nor possible at almost 400 pounds to do those things, to have children, to get married. And I really wanted those things, and I knew that if I really wanted to have those things in my life, then I was gonna have to work at it, and that no matter how you're losing weight, whether it be gastric bypass or any type of surgery or any type of program, it was gonna be difficult. But I knew that by sticking to it, by following everything that was asked, all the appointments, going to those and going to all the support groups, and really trying hard to lose the weight that was required was going to get me to where I needed to be in order to have the surgery and lose weight and have a better life. I decided to go with this program because I had known somebody who had used this program prior and they had had success. I did research other programs, but really thought that this was the best program for me. I liked the staff, I liked the setup of the support groups, and had really done my research, and this is what made me decide to go with this program. Since having gastric bypass surgery and losing a lot of weight, my life has changed completely. I've changed jobs, I've gotten a boyfriend, and now I can call my fiance. We're planning a wedding in a year. I just would have never had imagined my life how it is now before. Honestly, it's like a dream come true. Had I not lost this weight, I would feel like I would be essentially dead. And sort of that's what I felt like before I had surgery. And now I feel totally alive and happy and feeling like anything that I can do is achievable. If you're thinking about having weight loss surgery, really think about if this is something that you're ready for. It takes a lot of commitment. You have to be at all your appointments, and really what's most important is making sure that you're ready mentally. You're ready to put in the effort that you need to make your life a priority, make losing weight and getting healthier a priority. If you don't put other things aside and make you a priority, then you won't be. It's really important to make sure that you're focusing all your time on you and getting healthy.
Weight loss procedures fall into a couple of main categories. Restrictive operations, like sleeve gastrectomy, reduce the size of the stomach in order to limit the amount of food an individual can comfortably eat in one sitting, therefore restricting the overall caloric intake. Malabsorptive procedures, like the biliopancreatic diversion with or without the duodenal switch, are fairly complex operations that use malabsorption of ingested nutrients in order to result in weight loss. But this results in some less pleasant side effects. The gastric bypass has been considered the gold standard in that it combines the restrictive and the malabsorptive methods in a way that produces great weight loss with fewer side effects. At Atlantic Surgical Associates and Portsmouth Regional, we offer the gastric bypass and the sleeve gastrectomy as primary weight loss procedures, all done laparoscopically in more than 99% of cases.
Sleeve gastrectomy is a relatively new procedure, but has gained popularity because of its low complication rate and in some patients a good weight loss results that is compatible to Roux-en-Y gastric bypass. During sleeve gastrectomy, the stomach is reduced to about 25% of its original size by surgical removal of the large portion of the stomach along the greater curvature. The result is a sleeve or tube-like structure that restricts the amount of food a person can eat.
The hospital stay and restrictions for both gastric bypass and sleeve gastrectomy are very similar, with up to a 2-night hospital stay, 3 weeks off work, and a weight limit restriction of 10 pounds for about a month.
The more commonly performed Roux-en-Y gastric bypass significantly improves obesity-related comorbidities, including diabetes, sleep apnea, hypertension, arthritis, hyperlipidemia, stress incontinence, even infertility. It is a long-established method of surgical weight loss and results in restriction of caloric intake with profound early satiety. The long-term weight loss following gastric bypass is easily sustainable. The bypass can often provide almost 70 to 80% of excess weight loss, 60 to 70% on average. The nutritional risks following gastric bypass, including vitamin deficiencies, are uncommon and easily manageable. The gastric bypass involves creation of a small stomach pouch, which is connected to a loop of small bowel. Ingested food does not come into contact with more than 100 centimeters of small bowel, which would normally be absorbing those nutrients and calories.
After having Roux-en-Y gastric bypass surgery, you may expect to stay in the hospital for 1 to 2 nights with a 2 to 3 week recovery.
All patients must take lifelong supplements following weight loss surgery to prevent long-term nutrient and vitamin deficiencies. The number and type of the supplementation depends on the procedure performed.
Once you've completed this online seminar and submitted your program application, you'll meet with our program nurse practitioner. At that time, we'll review your medical history to be sure you meet criteria for weight loss surgery, and your journey will begin. You'll then be scheduled to meet with our program dietitian to review your current eating habits and develop new meal plans to help with losing your required pre-op weight. You'll also meet with our team physical therapist for an evaluation. They'll help you develop an exercise program, taking into consideration any activity restrictions and challenges. Our team psychologist will meet with you individually and schedule you to attend the behavior management workshop, where you'll learn important strategies for long-term success. You'll be required to attend at least one pre-op support group prior to surgery. These are offered monthly. Statistics show that patients who attend support groups have greater long-term success. You'll meet with our program NP monthly to monitor your completion of program components and pre-op weight loss. Once you've reached your pre-op weight loss goal, we'll order the necessary diagnostic studies and any lab work necessary. When we receive those results, we'll schedule you to see the surgeon. Once cleared by the surgeon, we'll submit for insurance pre-authorization. When we receive that, we'll schedule your surgery. Our program is a comprehensive combination of all the components proven to help patients be successful long-term. We view surgery as a tool to help you, the patient, change your quality of life and achieve better health. Our program takes an average of 3 to 6 months to complete, determined by the patient's motivation and ability to complete the required program components.
Here at the New Hampshire Surgical Weight Loss Center, we offer psychological services and behavioral skills training as part of the bariatric surgery program. You are embarking on a journey that can transform your life if you use the surgery effectively as a tool in weight loss and lifetime management. Through the program, we include a psychological and behavioral component because after surgery, all predictors of long-term success are behavioral. Therefore, your ability to learn and apply behavioral skills is extremely important in your success. A few bits of information may make your experience easier. There are 5 sessions that you attend that include Introduction to Basic Themes, Food and Eating Behavior, Changing Behavior, Stress Management, and Overcoming Obstacles. Each session gives you tools to help you through the bariatric surgery process and gives you the tools you need for success.
Now that you've learned more about our surgical treatment programs, take a moment to hear from another patient who recently underwent gastric bypass surgery.
My name is Ray Delcourt, and I am 49 years old, and I had the gastric bypass completed. My life before surgery, I was heading for disaster. I was overweight, I was heavy, my quality of life was very poor, tired a lot of fatigue, hard, difficult to move around and do everyday chores. So I decided to look into weight loss surgery here at Portsmouth. I found out about the program through an info session in South Berwick, Maine, and went and got some information about the program and knew it was the right one for me. My ultimate goal was to lose the weight, but more importantly to keep it off. One thing is to lose it, but anybody that's heavy knows that it's always a roller coaster. You're always losing and you're always gaining. You're always losing and you're always gaining. I really wanted to keep it off for life. And they keep on talking about a lifestyle change. And it really is a lifestyle change. It took me 49 years to figure that out. But it really is a lifestyle change. You've got to get in the mindset to do what they instruct you to do here. You can lose the weight and keep it off for life. And that really is my end goal, is to keep it off for life. My life has changed so positively since having the surgery. I'm able to move around a lot better, able to do work around the house. I'm a firefighter in town. I'm able to do my job a lot more proficiently. My quality of life has improved greatly since having the surgery. And it's all because of the team here at Portsmouth Hospital. This is a world-class organization, and if you're thinking about weight loss surgery, this is the place you want to have it done. I keep on telling everybody, and I believe this from the bottom of my heart, I was headed for medical disaster prior to surgery. And these folks saved my life. They really did. The team here is wonderful. They want you to succeed. They're committed. They're more committed than you are, and they're not going to let you fail. And I think that's what I like about these folks here at the Weight Loss Center at Portsmouth.
Before, during, and long after your surgery, Doctors Busden, Havaleshko, and Patchouli, as well as the entire staff at New Hampshire and Surgical Weight Loss Center, will provide the support you need for success.
You've already taken your first step by viewing this online seminar. Our staff will contact you about an initial consult, and your evaluation and training to become an optimal surgical candidate will begin. Thank you so much for viewing, and we hope you will join us in this very exciting process.
This is the last set of your 9-digit patient code number that you'll need to have available for pre-qualification for your first consult after viewing this seminar. Please keep this 9-digit number to use for verification of viewing this seminar. If you have questions, please call us. We're here to help. Welcome to the freedom to live the way you always wanted to.